Good evening and welcome to our COVID-19 update, a special edition on the coronavirus pandemic here on Channels Television. I am Ladi Akiri-Doluale. Here are the highlights at this hour. Federal government appeals for understanding over lockdown, asks citizens to see long-term gains. Health authorities plead against stigmatization of COVID-19 survivors. An African Union condemns President Donald Trump's decision to halt funding for the World Health Organization, just as confirmed COVID-19 cases surpassed 2 million worldwide. We begin in Abuja, where following the protests of many Nigerians regarding the negative impacts of the lockdown directive by the federal government, the chairman of the Presidential Task Force on COVID-19 has appealed for patience. The secretary to the government of the Federation, Boss Mustafa, says this is a decision that is taken in the interest of all Nigerians to curb the spread of the virus.
The president himself had alluded to the fact that it's a difficult decision, it's a painful decision, but it is a decision that must be taken in the interest of the people of Nigeria. We are mindful of that. We are cognizant of the fact that our social life has been disrupted by the lockdown in the entirety of this nation. But our constant appeal to the people of Nigeria is to see the long-term gain that will come out of this temporary dislocation in our communal life, and to try everything humanly possible to accommodate these processes that have been put in place for the overall good of all of our people.
The chairman of the Presidential Task Force on COVID-19, Boss Mustafa. It has been said that one of the problems victims of COVID-19 in Nigeria face is being reaccepted into the society without discrimination after treatment. Health experts from across the world have said there is no need to stigmatize victims, but rather it is important to empathize. Nigeria's Minister of Health, Dr. Osage Ehanire, speaking in Abuja today, says while physical distancing is important, this does not mean total avoidance of victims, as they need understanding of all at this time.
I also want to use the opportunity to speak against stigmatization. So we don't want stigmatization going on, people feeling that this is something that is so terrible that you must be ashamed of it, or that you must not let people know. You know that in the UK, the Prime Minister made his own known that he was in treatment, and also the people as important as the Crown Prince and many other persons in America, they have said it. But the population should not drive stigma by wanting to know where people live so that you can avoid that area. So you take your own measures and do not contribute to using that as an excuse for creating stigma.
The federal government also today issued a guideline for the use of face masks in the country. The government said while wearing face masks is to be encouraged, it must be used only in combination with hand washing, physical distancing, and good respiratory hygiene, as well as sanitizing surfaces, but not as a substitute for them. The Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu, displayed to Nigerians the right way to wear and remove the face mask in order to avoid infection.
We're intensifying our surveillance in healthcare centers, so hospitals around Lagos and the FCT, to collect samples from people with an acute respiratory infection. In Abuja, certain communities, we're going door to door to collect samples from people that have an acute respiratory infection. We're doing the same in Lagos. So in these two states where there's a high incidence of infection, we're now strengthening our surveillance and going to the patient to collect these samples. The wearing of masks or equivalent is recommended as an optional additional layer in addition to measures like social distancing, physical distancing, hand and respiratory hygiene measures. So this mask, like the Honorable Minister rightly said, is not to be done in replacement of, but in addition to all the other measures that we have recommended in the past. However, it is critical that we learn how to properly put on the mask and take them up by their hands. Once you touch the mask, especially when you touch the inside surface of the mask, that's exactly where we don't need you touching, because that's exactly where the viruses that we exhale are. So please, what we call the donning and doffing, the putting on and off of masks, is probably more important sometimes than the wearing of masks, in order not to increase the risk. When we say improvised masks are an option, they are an option. But they're not an option if you're going to wear the same cloth mask every day for the next month. You have to wash these as frequently as you can possibly do, at least once a day, for it to make any sense at all. And this is the advice for people that are not working in the medical field.
Director General of the Nigeria Center for Disease Control, Chikwe Ihekwezu. Now, for the very latest on the figures of COVID-19 confirmed cases in Nigeria, please visit the website of the Nigeria Center for Disease Control, the NCDC, at www.covid19.ncdc.gov.ng. There you will find the total number of confirmed cases in Nigeria, which stands at 373 at the moment, as you can see from what is being displayed on your screen. That is, in fact, the NCDC website. A breakdown of the cases in each of the states shows that Lagos has 214 cases, the FCT 58, Osun 20, Edo has 16, Oyo 11, 9 in Ogun, Bauchi and Kaduna have 6 each, Akwa Ibom and Katsina 5, Kwara and Kano 4, Ondo and Delta 3, while Enugu, Ekiti and Rivers have 2 cases, and Benue, Niger and Anambra have 1 case each. A total of 99 patients have been discharged, while 11 deaths have been recorded. Now let's go to our Abuja studios, where our correspondent, Linda Akiwa, is ready. Good evening, Linda. Nice to see you. Trust you're keeping safe.
I'm trying to. Hello, Ladi. Nice to see you too.
Now, I understand that community testing is the name of the game in the FCT today. So what can you tell us about that?
Okay, so today the FCT administration began community testing for COVID-19 in the FCT. The testing is to identify people who are positive for COVID-19 and begin isolation and treatment for such people. Specifically, the team began the testing today at Mabushi, which is one of the suburbs in the FCT. Now, some sensitization and announcement had been done prior to today, informing residents of the exercise and asking people to come out and be tested. So how does this work? Is that residents who come out were interviewed, where they were asked questions such as their travel history, if they have had any contact with people who tested positive for COVID-19, as well as if they have pre-existing health conditions, maybe like asthma, high blood pressure, and so on and so forth. Now, after these questions were asked, some were tested, that their samples were taken, while some others who the health personnel deemed not eligible for the test were sent home. Now, it will take a week for the results to come out. The FCTA is doing this to try to test more people, and because if you recall, the NCDC has said that the issue right now is getting more samples in the labs for testing. However, it's not clear at the moment how long this exercise is expected to last, but we know the Public Health Department of the FCTA will be going around different parts of the FCT to do these tests. Ladi.
Now, something else that came up during the course of today is that the FCT administration released guidelines on the restriction of movement within the FCT. What can you tell us about that?
Okay, so we saw the FCTA, they released, like you said, guidelines on the cessation of movement in the FCT. Now, it's pertinent to note that one of the reasons for this new guidelines is, according to the FCT administration, is what we have spoken about, Ladi, repeatedly on this program, and that is that some residents in the satellite towns have largely ignored the lockdown directive. And so the FCT administration is directing that markets' operational days are henceforth reduced to 2 days in a week. That's on Wednesdays and Saturdays only. Now, residents from now going forward or in the next 2 weeks are to patronize only neighborhood markets, as movements from one district of the FCT to another now constitutes a violation of the lockdown. So according to another part of the guideline is that mobile courts will now be activated to try all violators of the directive on the cessation of movement in the FCT. Now, motorcycles have also been barred from operating in 2 satellite towns, that's Kubwa and Dutse Alaji, during the lockdown. We'll monitor these new developments and see how they play out. Ladi.
Thank you very much, correspondent Linda Akibe. From our Abuja studios, we trust that you will do. Please stay safe.
Thank you, Ladi.
Now, joining me in the studios is a consultant public health physician and chairman of the Lagos chapter of the Association of Public Health Physicians of Nigeria, Dr. Tolu Olufunlayo. Thank you so much for joining us.
Thank you for having me. Good evening.
Now, I guess maybe a good place to start is where the NCDC DG stopped off today, which is the issue of masks.
Yes.
Now, everybody is wearing masks, some in fairly comical fashion. But the protocol, he's showing it wasn't completely clear there because he was already wearing his. But is this helpful in any way for those who want to wear masks in addition to all the other protocols that have been put in place? Is it really helpful?
Okay, thank you very much. The issue of masks has been discussed, looked into, and now based on evidence, we have arrived at some guidelines, and they were clearly spelled out today by the DG of the NCDC. Now, the thing is this. We must emphasize, like the minister also did emphasize, that masks should not be used as a substitute for other preventive measures, but they are an optional, additional preventive measure. One of the reasons why masks were not advocated for initially was because there's a worldwide scarcity or shortage of PPEs in general and masks in particular. Well, as you know, nobody was really thinking we would have a pandemic, and so we didn't stockpile masks.
Masks, that's right.
And we heard today that 50% of all masks are produced in China. So when China shut down, a lot of things shut down. So in recommending masks, the government and the authorities have carefully sat down to look at the evidence. They found there is some additional benefit. So there are 2 clear messages. One is that you can use masks, but don't feel confident when you use a mask and then drop your guard. So if you're using a mask, you must still maintain hand hygiene, respiratory hygiene, and physical distancing. So those are the key preventive measures. And of course, that's one of the reasons why the lockdown is in place.
Now, that's on one side. Yes.
So the other thing I must quickly mention is that we don't want people, the general public, to use the medical or surgical masks that are meant for hospital use, because we can't allow the frontliners not to have masks to use for their work. They'll be endangered. So if the general public need to use, they must use alternatives, cloth-made, homemade, and I think guidelines are being released. The governor of Lagos State yesterday in his statement said that some masks are being mass-produced for the state, and I'm sure they will be done in cognizance of the guidelines that have been laid down for a good mask.
Well, I'm sorry to cut in, but people will wonder, they ask you if these ones that you are now referring to as alternatives are as effective as the ones that should be reserved, as you pointed out, for the frontline health workers. That why should we be satisfied with cloth masks if the health workers are to be given the other type, which may or may not be more effective?
Well, the thing is this. You have to protect your greatest asset. If we don't have the healthcare workers caring for the patients, then everybody else is in danger. So if they are well protected, because they need 100%, because these are positive patients. For those of us going around, maybe you're going to the market, you're going to a public place, I mean, that cannot really be avoided. And there was that stress on that cannot be avoided. And you think you're going to come in contact with the number of people, or you may not be able to guarantee social distancing, then you can use it as an added protection. And in some climes or some countries, they have actually advocated that everybody outside uses a mask. Okay. Reason being that for those who are asymptomatic, for those who are pre-symptomatic, and those with mild symptoms, they would reduce the amount of droplets that they are shedding into the environment, and then they are protecting everybody else. So now that that guideline has come out, if more of us are wearing masks outside, the tendency will be that there will be less virus to drop on tables, to, you know, go around in the environment, and therefore to infect other people. So it's still of benefit, but we must not use it as a substitute for the other preventive measures.
Now, one of the things, of course, that did come up in the course of yesterday night to today is the United States halting of funding to the World Health Organization. And I don't know what you make of that. Maybe I should start by asking what do you make of that?
Well, we could say that that is a political war. Of course, the President of the United States is expressing his displeasure at the World Health Organization not giving signals, in his own opinion, in good time. It's a difficult situation in the sense that that judgment call again, for a world body to give direction, they must first of all consider the evidence. Right. And sometimes that takes time. But we must remember that the World Health Organization says it provides guidance for nations to follow. It does not usually enforce, excepting it is something that is really critical. And as President Trump said, he said they went ahead to institute those travel bans despite WHO's reluctance to back them up. So I think he's trying to shake a little, but let me leave that for the politicians to interpret. Okay,
we've got just a minute before break. I wanted to ask you about the community testing that is now going on, because a lot of those who have spoken have said that, look, the issue of imports seem to have been de-emphasized now, and we're now looking at what's going on internally.
In-house.
And that would then bring us to communities. So, of course, as part of the reports that we had testing in FCT today beginning, and then, of course, in Lagos yesterday, my guest here talked about it as well. Dr. Roberts talked about the fact that in Lagos they're moving into the communities. I'm going to ask if that's the way to go, and if so, how do we go about that, considering the fact that here and there you have people who are not too happy with the fact that they've been asked to stay in. How do you overcome this? What's the balance? But that will be after this break. So Dr. Olufunlayo will be staying with us till we come back on the other side. Please stay tuned. Thanks for staying tuned. Welcome back to our COVID-19 special at this hour. I still have with me the president, the chairman, actually, of the Association of Public Health Physicians of Nigeria, Lagos chapter, Dr. Tolu Olufunlayo, with me in the studio. Now, before we went on the break, I said I was going to ask you about the issue of community testing. What did you make of that?
Okay, well, let me pick it up from here. Today, the DG of the NCDC also did speak about them designating centers, within the communities where people would be able to go for testing, because they've spoken about having more capacity to test, but not being able to get the required samples to, take up that capacity.
Right.
And I must say that in Lagos State, we started that already. Tomorrow in Shomolu local government, they are starting or flagging off a community counseling and testing center. I don't have the venue, but I'm sure it will be on different publicity platforms. So people can come in there, get tested, and get counseled about COVID-19, get whatever information they need, and other services will be provided there as well. So I think they're going to have probably one per local government in Lagos State. So they're trying to, get things closer to the people. And as public health physicians, we do advocate that, we need to engage people at the community level. When people are engaged at the community level, they will more likely want to comply with whatever directives are given to mitigate the spread of the disease, such as the lockdown. Of course, we do understand that people are feeling the pangs of being kept at home, not being able to make an income, especially for the daily earners. But when they see, that government is doing something right or that this is for a good reason, they are more likely to try to, make ends meet, comply, and so on. Of course, this does not negate the need for palliatives from the government and other well-meaning organizations, which, are being reorganized in this second phase to try and reach those who actually really do need them.
Now, I'm going to ask a double-barreled question, but both have to do with the public health physicians themselves. Okay. The first is, do you have the fear that with all these initiatives going on simultaneously, virtually across the country, your group can be overwhelmed? There isn't an infinite number of you. Then secondly, what's the situation now with regards to the PPEs we talked about earlier? Not just masks now, the full body suits and other things that the health personnel require, who are in the front line, who are facing the actual victims of COVID-19.
Okay. All right. So in terms of being overwhelmed, that comes from time to time. It's not just about the actual number alone. It's also about coordination. But I think for Lagos State, for example, fortunately, unfortunately, we saw the first cases in Nigeria in Lagos.
Indeed.
And Lagos had already been prepared, and we want to commend, His Excellency the Governor and the structures in Lagos State for putting the incident command system in place ahead of time. Of course, we had that from the Ebola crisis in 2014, but we had actually continued to strengthen it over the years. And the current Commissioner for Health had been very involved in, biosafety and biosecurity, and he had been one of the key players in that. So if we had not had a coordinated response, this is enough to overwhelm any group of professionals. As you know, in Nigeria, we have inadequate number of healthcare professionals, both doctors and other members of the health team. So it's not easy. At the beginning of the pandemic in Nigeria, we found it a little difficult because at that time we didn't have enough PPEs. But gradually, things are beginning to ease up. But I must tell you that it is still not optimal. There is still need for complete PPEs to be deployed to health facilities, both public and private. Before I came on here tonight, I got a message from a colleague working abroad, and she gave a list of all the PPEs that they must put on before seeing any patient, because every patient is taken as a suspected COVID-19 patient. Right. We need to get to that point in Nigeria where every health practitioner that is seeing any case anywhere is prepared as if that person is a COVID-19 patient. Because if we do not preserve the lives of the frontline workers, like I said, it will get to a point that we won't even have the people to treat. There are some very bad examples from some other countries where you hear of people dying and nobody to bury them. It's gotten that bad. So we don't want chaos.
At this point.
Yes.
Indeed. Thank you so very much, Dr. Olufunlaya, for coming in today. It's been a pleasure having you with us. Dr. Olufunlaya, of course, is the chairman of the Lagos chapter of the Association of Public Health Physicians of Nigeria. Thank you so much for coming in.
Thank you very much for having me.
We will have an update on the security situation, but before that, let's go to our Kano station. Let's go to our Kano studios where our correspondent Idris Jibrin is going to give us an update of the pre-preparation ahead of tomorrow's lockdown in Kano. Good evening, Idris. What's the situation?
Yeah, good evening, Ladi. The situation in Kano State, tomorrow it's going to be the D-Day for the lockdown. Kano, by 10 p.m. tomorrow, Kano will be in a total lockdown. And actually, the state government is preparing for that. A lot of measures are being put in place. Security operatives are being mobilized to ensure that residents comply with the lockdown directives. And then I have earlier spoken with the chairman of the state task force on COVID-19, who is, of course, the Kano State Deputy Governor Nasiru Gawuna, regarding the updates and the developments coming up in Kano State. And he confirmed to me that so far they have 90 suspected cases that are presently at the testing center in the Malam Aminu Kano Teaching Hospital, and they are waiting for their results. And as soon as that result arrives, they will announce whether they are positive or negative. But like we've been saying, the actual positive cases in Kano State stands at 9 as at this moment. But the government is taking all the necessary steps to see how they can be able to trace other contacts, other people who were in contact with the initial index case. One thing that you need to understand, Ladi, here is that the 5 cases that were identified yesterday, earlier today, 3 of them are actually those who were confirmed by the state government, and 2 are independent, away from the ones that were identified by the state government. So those 2, actually, they have contacts that are currently being traced. The deputy governor told me that one of the person who used to deliver food to those 2 people, 2 independent people, they are still trying to trace him to find out where he is so that they can be able to test him. So as it stands now in Kano, we have 90 people at the Aminu Kano Teaching Hospital testing center who are going to be tested, and the results will come out as soon as possible. So the preparation is going on, and by tomorrow, Kano is really going to be in a total lockdown.
All right, then. Thank you very much, our correspondent Idris Jibrin in our Kano studios. We trust that you keep safe and keep us informed of how the last-minute preparations for that lockdown are going. Thank you very much, Idris.
Thank you.
Now let's come to Lagos, the nation's commercial capital, where the Deputy Inspector General of Police in charge of the southwestern states, Babatunde Ogunyowo, has been speaking on the security of Lagos and Ogun residents. The Southwest Police Boss asked residents in the 2 states to give adequate information to the police to enable prompt action. Mr. Ogunyowo spoke today on our political program, Politics Today.
In the first instance, security is for everybody. It's not only the business of the security agents. So if people have come out to assist police in securing the area, I think they are still in the line, as long as they are in line with the law. Nigerians should not be apprehensive over rumor. A lot of these things are just based on rumor. Even when people claim that they are robbing and we send policemen there, we find out that it's these local vigilantes who have probably decided to constitute themselves into the vigilante in their group to ensure the safety of their area. So we need people to actually confirm information before they start spreading rumor around and creating unnecessary tension. Well, I don't know about 1 million gang. You know, Nigerians can always create name for a group of people, but what we know is either 1 million gang, anybody who is running for the law is a criminal. Because I don't know whether they have been able to do a population census to know that this gang is up to 1 million. I can tell you that to a large extent, those incidents are not happening. People just blow them out of proportion.
And from Lagos, we go to the north-central state of Nasarawa, where our correspondent Halima Gayam is standing by to talk about the Northern Governors meeting on not locking down, amongst others. Halima, good evening.
The world is fighting the coronavirus pandemic, so is Nigeria. Now, amid increasing number of confirmed cases of the virus in the country, state governors are putting in place measures to contain any conceivable spread of the virus to their various domains. Just yesterday, Northern States governors held a teleconference where they shared experience on how the COVID-19 pandemic is affecting the region. The meeting, which was chaired by the chairman of the forum and governor of Plateau State, Simon Lalong, resolved to strengthen preventive measures. The governors noted that so far the lockdown in some states in the region has had varying level of success, but also raised concerns that enforcing cross-border movements remains a challenge, as some of the cases recorded in some states were imported from outside, despite the closure of borders by states. They agreed that at the moment, each state would adopt the measure suitable to each setting, because a total lockdown of the region will come at a very high cost, since most of its citizens are farmers who need to go to farms since the rains have started. The governors also lamented that the region has no testing centers, which is very disturbing for them, and have resolved to liaise with the federal government to get one testing center, while highly populated states in the region would get two. Now, despite all these measures put in place by the governors, the governments of Benue and Taraba are still contending with the lingering crisis between the Tiv and Jikun ethnic groups, which prompted a mediation and joint security meeting in Lafia today. Now, after hours of deliberations, they agreed to clamp down on suspected militias residing in both Benue and Taraba states, and to also ensure that all the internally displaced persons in Taraba state return home since the rains have started. These measures are expected to bring about a lasting solution, even though several of this type of meeting have been held in the past. Now, during the weekend, the overseer of Lafia North Development Area held the wedding, despite ban on social gatherings by the government, and this led to his arrest and some other persons. He has been granted bail already, but the Commissioner of Police said he would soon be charged to court for violating an executive order on social gatherings.
Our correspondent Halima Gayam, thank you very much from Lafia. And then we go to Ibadan, the Oyo State capital, where our correspondent Bukola Oriewo has an update on the embarkation by the state government of the fumigation of both private and business premises right across the state.
Good evening, and here is COVID-19 update from Ibadan, the Oyo State capital. Decontamination of government premises, that is the government secretariat at Agodi, began on Monday, and according to the program, it's going to go through the entire week, because it started with the governor's office, and of course other ministries too are being decontaminated. And I learned that the program is also in conjunction with private entities too, who have been advised to also ensure that they fumigate and decontaminate their premises while measures are being put in place to ensure that this pandemic is controlled. Apart from this, there's some cheering news regarding testing in Oyo State. Oyo State government just began free testing for 2,000 people yesterday. And according to the organizers, these 2,000 people are going to be tested. But they are beginning first with the contact tracing that has been done for those people who have been confirmed positive or those who have suspicions. They are testing those people who have been traced before now. And then having exhausted that, then they can begin to test the general public to see who has symptoms and who are not, who are positive and who are not. Apart from that, social distancing has been a huge issue, especially in most places we visit in Ibadan, especially marketplaces. The government had ordered that only people selling essential items, especially food items, should be open for business. But this has not been the case. Just earlier on today, a lot of security operatives were sighted at the spare parts market at Gate, which was a beehive of activities, and that was contrary to what the government had directed. Apart from this, in other markets across the state, you still find people coming to the market to do their business, which does not speak well for the control of this pandemic. But I know that security, I have spoken to the Commissioner of Police earlier on, who said that every effort will be put in to make sure that people actually comply with the curfew. And I know that the government too is working with all security operatives to make sure that this actually gets done. People who do not have businesses and marketplaces must stay home. From Ibadan, the Oyo State capital, Bukola Ariowo.
Thanks for staying tuned. Welcome back. We now go to Atlanta, Georgia in the United States. We're being joined via Skype by a consultant pediatrician with the Ivy League clinics in Atlanta, Dr. Nneka Unachukwu. Dr. Unachukwu, good evening. Thanks for being with us at this time.
Thank you for having me.
Now, in all of this about COVID-19, one particularly vulnerable group keeps getting left out of the conversation, and that's the children. Now, how are children faring in all of this as this pandemic continues to grow and to go across the world?
Well, it's a little surprising, but children are actually not as affected as adults. The data that we have currently shows that about 1.7% of the cases are children, which is good news and tricky news as well. So not as many children. And when they do have the disease, most of them have no symptoms, or they really have mild disease. It's like a cold. So they have a fever and a runny nose and a cough, which is fairly common in kids. But the problem with that is that they now become the vectors. It is easy for them to transmit the disease to people who are elderly, who are at higher risk, and people who are immunocompromised. So they walk around as people who can give others infection, and nobody is the wiser. So they're not as affected, but that doesn't mean we slow down on anything we do, because they could be vectors.
Now, is there a medical explanation as to why they don't seem to be particularly affected? Is it that their immunity has been less affected being so small, or is there some other kind of explanation why they appear not to be quite at as much risk as everybody else?
Well, at this point, nobody's really sure, because this is new and we haven't done enough research to say definitely this is why. There is some speculation that their immune response to it is different, and that's why. But for now, it's just speculation. We really don't know.
Now, they may not be particularly at risk, but it is possible that young children can be affected by this. So how do we go about protecting them?
So it's the same measures we'll use for the adults, but because they're children, it's just a little more tricky. But it's the same measures. So lots of hand washing. But anybody who has kids knows that you have to reinforce that message 200 times for them to get it once. But we have to be very vigilant with that. Hand washing, about 20 seconds. They can sing a whole song, the ABC song or happy birthday song. Make sure they're scrubbing, because their hands are on everything. And for the little ones, it goes from everything to their mouths. So we need to do a lot of hand washing. And for the parents, we really have to reinforce that. It will require a lot of reminding. So that has to be done. Good respiratory hygiene. So sneezing or coughing into their sleeves, not into their hands, so that they don't put that on, somebody else, because again, they can be vectors. Social distancing, which with little kids, it's a little harder because you can be walking with them and look away and they're gone. And they've gone to hug somebody else before you even knew it. So things like play dates, birthday parties, places where there are large groups of people, you don't really want to be taking children there for two reasons. One, they can pick it up. But secondly, they may have COVID-19 and then they spread it to that group as well. So that needs to be done as well. Even in the US where we have a lot of cases, I would still hear people say birthday party. I'm like, no, so those things you do want to stay with. It's difficult times is different, but we have to do that. So social distancing, very important, hand washing, good respiratory hygiene, and then places, surfaces that they would go to frequently need to be cleaned and wiped down frequently. Countertops, doorknobs, stuff like that, because again, they touch that straight to their mouth, to their face, which makes it easier for them to get infection.
Now, we have just about 60 seconds, and in those 60 seconds, I want you to try to give a very compressed executive brief about how, when they get this, if eventually they get this, how is this to be managed?
So if they get it, most of the time it's mild disease. So it'll be, fever management, keep them away from others, let them rest, let them get fluids. If they have a more severe disease, then they should be seen by their healthcare provider at the hospital, and they'll take care of them.
Thank you very much. You managed to keep within the 1 minute. Thank you very much, Dr. Nneka Onachukwu, who is, of course, a consultant pediatrician who joined us via Skype from Atlanta in the United States. Thank you so much for being with us.
Thank you for having me.
And that's where we'll wrap up tonight's COVID-19 special at this hour. Thanks for being with us. Please do keep the pictures and the short videos coming. The handles are on your screen. And, of course, for any news and updates, you can go to the Nigeria Center for Disease Control website. It has tips for what to do in case of emergencies, what numbers to call, and all of that. So please utilize them. My name is Ladi Akeredoluale. Do have yourselves a wonderful evening.